The country's COVID-19 alert level system remains for now, as authorities continue to study new ways of classification. In a statement, Malacanang said President Marcos agreed to retain the current restrictions to avoid public confusion. Marcos met with health officials to discuss possible reclassification measures which would be more compatible with the current COVID situation in the country. The DOH said it can craft new schemes by the second week of August. DOH-OIC Maria Rosario Vergeire agrees with adjusting the classification. Members of the Advisory Council of Experts also seek a traffic light approach, which they believe is a simpler scheme. Under this scheme, a red, yellow, green, color-coded classification is adopted to indicate high, medium, and low alert levels. Average daily attack and healthcare utilization rates will still be considered.
Each area you can have a green, yellow, and red, no? And whether it's, you can go down to the region, the provinces, no? And even the barangay level. It'll be more transparent.
We can have a different table for restrictions based on the national and local government level agreements. But it's important that we simplify so that risk decision-making by our individuals, our kababayans, can be made more easily.
Aside from this, the DOH will also reconstitute member agencies of the IATF, only to those with relevant and intended functions. IATF meetings will be streamlined and will utilize the platform of the NDRRMC, which will replace the National Task Force Against COVID-19. Former NTF Special Advisor Dr. Ted Herbosa welcomed this development.
Agreeing with the President to restudy, asking the DOH to restudy the composition of the IATF. We don't make it weaker by streamlining it, but we make it consistent with what is happening now.
But the Alta Research Group says otherwise, noting the government should instead widen the bench to gain more perspectives.
When we say widen the bench, let's include independent scientists, no? Let's include people from the private sector like ACE, no? So instead of restricting, widen, because the perspectives that will be shared will be fruitful.
Meanwhile, the group is leaving it to the government to assess whether the COVID state of calamity, which will lapse in September, should be extended. In the meantime, the DOH is calling on the public to continue following minimum health protocols and to get their booster shots as soon as possible. For News 5, JC Cosico, we are One News.